Ischaemic colitis. Now that may sound like medical jargon, but let's break down the meaning. Ischemia means the restriction of blood supply, and colitis means inflammation of the colon. Hence, ischemic colitis is the inflammation of the colon as a result of inadequate blood supply. It is the most common form of bowel ischemia, with a greater occurrence in the elderly and the cause of approximately 1 in 2,000 hospitalizations a year. However, its incidence is severely underestimated considering the high rate of misdiagnosis. Signs and symptoms. Ischaemic colitis non-specifically presents itself, characterized by vague symptoms such as inflammation, abdominal pain, rectal bleeding, abdominal tenderness, and infection. Hence, the diagnosis is often delayed. The disease progresses in 3 distinct phases: hyperactive, paralytic, and the shock phase where fluids start to leak through the damaged colon lining. Patients in this phase often require intensive care. Pathophysiology and pathogenesis. The colon receives blood supply from the inferior and superior mesenteric artery, and there is also collateral circulation via the marginal artery. However, there are watershed areas which are most vulnerable to ischemia, as they have the fewest vascular collaterals, for example the splenic flexure. Now let's divulge the pathogenesis of this disease, including the 2 main types, occlusive and non-occlusive. Non-occlusive develops due to vasoconstriction. Arteries feeding the colon are sensitive to vasoconstrictors due to an evolutionary adaptation to shunt blood away from the bowel and to the heart and brain in times of stress. Vasoconstriction occurs via the sympathetic nervous system. Noradrenaline gets released, then interacts with alpha-1 adrenergic receptors, and this results in increased intracellular calcium. The calcium complexes with calmodulin, which activates myosin light chain kinase. Phosphorylation ensues to cause cross-bridge cycling or a contraction. Occlusive ischemia indicates that a blockage has cut off blood flow to the colon and is mostly the result of a thromboembolism. Thrombosis is dependent on Virchow's triad. When a blood vessel gets damaged, platelets bind to the injured site to provide a weak plug. Once this plug is formed, a stronger one is needed to stabilize it, known as secondary hemostasis. The extrinsic and intrinsic pathways converge on coagulation factor 10. Factor 10 causes the formation of thrombin, the signaling molecule for platelets. Thrombin then causes the activation of fibrin, which binds to platelets together to form a strong clot. Treatment and management. If you have been diagnosed with mild to moderate ischemia, it can be easily treated with supportive care. This entails use of IV fluids or some medications. You will be placed on bowel rest, meaning nil by mouth. If you develop uncontrolled bleeding or a failure to improve, surgical intervention is required. With your new diagnosis of ischemic colitis, the hardest part is already complete, the identification. Depending on disease progression, you have a very positive prognosis. And that's what you need to know if you're dealing with ischemic colitis.